So with your permission, can we start with the program?
Yeah, like this.
Okay.
Shall I make somebody else also a co-host?
Uh,
I will make Deepa. Deepa, I'm making you co-host.
Amol sir, do you have any PPT to share?
हाँ, अमूल सर का भी मैं कर दूँ.
Yes, yes.
Okay.
So I
I'll make you also co-host, sir, so that you can share.
मुझे भी कर दीजिए सर.
yes, I will share a screen from this side. Actually, voice was breaking in between. Screen है बगल में.
Deepa, you are a co-host. Manisha also is there, na?
Yes, sir, I'm also there.
So let me make you co-host, Manisha.
Okay, sir, no problem.
Should I share the screen?
so in 2 minutes, we'll start with the
Okay.
introduction and then
Sure, sure, sure,
we'll
sure.
probably introduce you to all the participants. Yeah. So good evening, ladies and gentlemen. And today is the auspicious day of the we are celebrating our second foundation day. Academy of Hypnosis is officially 2 years old today. And we are really thankful to our president, Dr. B.M. Palan, who has been our backbone, who gives us the dreams and who sets the vision for the. And we also have with us Vice President of Academy of Hypnosis, Professor Rakesh Jain sir, whose academic brilliance, whose patience, and whose guidance is really important for Academy's work and progress. And we have also with us Dr. Prasanta Roy, who is also Treasurer of Academy of Hypnosis. I welcome you all, and I request Dr. Prasanta to kindly introduce our today's guest.
Thank you. It is really a special day, and this is the second Foundation Day that we are observing. And we are very happy that we are having two important faculty of our nations who are expert in their field, Dr. Amool Ranjan Singh and Dr. Dayal Mirchandani. To introduce Dr. Amool Ranjan Singh, the first thing, he had been my teacher. That is the first thing. And if you can imagine his expertise uh, uh, when you know that he is having around 300 research publications in international and national journals on various aspects of the clinical psychology, and having the number of the government of India sponsored research work under his banner. He had been the director and the founder member of Department of Clinical Psychology, RINPAS, Ranchi, and he has guided over 24, 25 PhD scholars, and he has guided more than 4 dozens of MPhil dissertation during his work. He is having various expertise area, and I know the behavior therapy is one of the domain, and the projective assessment is one of the domain. He has also developed a number of psychological test material there at RINPAS with his more than 30 years of the clinical expertise and teaching expertise. We are very happy that the sir has agreed to be the part of today's discussion. And Dr. Dayal Mirchandani, he is a very popular, he had been a very popular psychiatrist when he was working in Andheri, West Mumbai. After completion of his MBBS from Armed Force Medical College, He did his MD in psychological medicine from TNMC, and then he was working as a private practitioner since 1981 at Mumbai, and after he retired from there, he shifted to Pune. He is among the few psychiatrists who are extensively working on hypnotherapy, psychotherapy, as part of his the Behavioral Science Network or Behavioral Science Foundation that he was the founder member of it. He had given the extensive training on various psychotherapy and hypnotherapy, and he is actively using hypnotherapy in his the clinical practice. He has surprisingly he has written the book on healing heart naturally. Uh, so that is a very interesting read, and we are also very happy that uh, the kind of enthusiasm that he shows towards hypnotherapy here in India, and that can be really very motivating um, for all of us. Thank you, sir, to be the part of it. Over to Nidhi.
Okay, thank you, Dr. Prashant, for very elaborate introduction of both the speakers, and I am really privileged to be part of today's deliberation, which is going to take place in the August Regents, and participants are from different parts of the country. And I am especially grateful to Professor Palan and Dr. Rakesh Jain for giving me opportunity to be part of today's discussion on the occasion of second foundation day of our Academy of Hypnosis. So my topic is very general. Is my slide visible?
Yes, sir.
Hello?
Yes, sir, it
Yes,
is
sir.
visible.
Yes, sir.
Okay. Okay. So the topic is such. I think that everybody would like to just go through it, because hypnosis is something the people who practice, we get wide range of opportunity to serve our population, both clinical and non-clinical, both ways. That way I always think. So here I will be focusing on the clinical part today, and in fact. My journey into it has also been very long, and every day I am learning from books, from my patients who are my actual teachers, and all the young uh, professionals who are interested into it, because I keep reading their contributions and their feedback also. Many times I get. So I hope that I will just start from the very primary point. Why this topic I have chosen? Because in order to understand the clinical application of hypnosis, we first must understand the difference between hypnosis and hypnotherapy. Because this is one of the important aspects, because hypnosis has always been part of uh, healing process for a long time, and it has also been used in, say, for a sort of experience people get or derive out of it in general population, and that was practiced that way in fact for years. And these are the regions that in between somewhere maybe few years there was people were a bit skeptical also using the term hypnosis as such, because there are people who have been using it from altogether a different perspective. So hypnosis is basically characterized by an altered state of consciousness. I always tell that yes, though we tell this is the altered state of consciousness, but this is more a sort of dual awareness, and which is very important to be understood, because when we are talking about trance in hypnosis, or in little different way if we talk, it is also the fact that when we talk about the meditation, a situation or a time comes when we go into the trance. So basically, it is a sort of process where we try to help the individual to reach a position which is called trance. So that is basically altered state, though we are telling, but yes, the individual is very focused. At the same time, he is aware about what all is happening around him. So both way this can be explained that way, but this is what generally we understand. So hypnosis as a waking state of awareness or consciousness in which a person's attention is detached from his or her immediate environment and is absorbed by inner experiences such as feeling, cognition, and imagery. Here we have to understand one more fact, that whenever we are in trance, it is not that we are completely detached or withdrawn. We are very much aware about what all is happening around us, but naturally, we will have the very selective understanding of something what we are interested in or what is important to us at that point of time. So, hypnotherapy is naturally a bit uh, next step in a way. On the other hand, is a technique that uses hypnosis or induces hypnotic trance in a patient in order to alter individual's thoughts. So we have been practicing it in a different population. So both the things, and what I have felt is that yes, as an adjunct, this has been a wonderful method of helping the individual not only in terms of healing process, but in order to sustain what all we are otherwise able to gain in any therapeutic process. So there are different types of hypnotherapy. I'm just giving the name and basic idea. It is not that I'm going to talk about it as such. So body scan technique in hypnosis, induction body scan technique hypnosis progresses in an organized manner, relaxing one part of the body. Everybody is aware about it. So still, I thought that before we get into the application part, there are different ways we can go into that phase of hypnosis or applying this hypnosis for our therapeutic point of view. So, relaxing one part of the body after another. After the induction, the client is guided through organized relaxation process. That is the hallmark of this method. And this is done in a very meticulous and with a very specific pace, with pauses in between to ensure that what all we are talking to the client or the patient is properly comprehended and assimilated so that he or she is able to act accordingly in little advanced phase of this uh, process. So when the client relaxes, they learn to pinpoint the beginning of a place and how to build on that point unless they experience a profound pervasive sense of relaxation. That is the hallmark, as I said, that is from where we should think of a starting, whatever method we choose, but ultimately our aim is very simple, that we have to help the individual to be more focused. Eye fixation technique, very old one and very popular. Even now, many people do both in clinical and non-clinical practice, and that is no. The I think the majority of us who are celebrating our second foundation day, I mean of the Academy of Hypnosis, they must be well versed with it, and this is also excellent method to help the individual to reach to a point from where he can embark on a new journey of experiencing something new or assimilating the experiences being told or shared by the clinician. Age regression technique, hypnotherapists employ this hypnosis approach to help the patient recall the thoughts and emotions. That comes little later after the primary phase of going, but that is also one of the, because the emotions are directly linked to our past experiences. So what all age are we interested in? What all emotions are disturbing us, are becoming a sort of barrier in our progress? So hypnotic method definitely help us to somehow enter into that phase and help the individual to have that experience in a more objective manner. So that is the work of the clinician who gradually takes the individual into that phase so that they are able to start thinking, talking, or sharing their experiences of that particular age, and that gives them relief, especially if they had any major conflict of that age and which is becoming a sort of barrier in our day-to-day life. So that is what I have in this slide I have said, and it is basically in what way we reframe all those experiences in a newer way, which are less anxiety arousing at present. Because if we do it, keeping in the mind about the background of the patient or the say period of earlier few years, naturally again if we take that individual into that phase, that lowers their experiences of anxiety, especially the anxiety if we are attached to the memories sometime about which we are aware about it, and sometime maybe that becomes a process of our unconscious mind as well. So that depends how deeper we go and how long do we take, what all topics do we decide to talk about, what all things are important to the client at present, and because ultimately these are the basic determinants which will substantiate the underlying motivation of the client to be part of this particular process, and which is done very gradually. But of course, as a clinician, we have to be quite confident, and our method of inducing or moving with the patient has to be something which must give confidence in the client also. Post-hypnotic suggestion. This is one of the techniques which is used very frequently in various clinical populations, and that works like a wonder. Whether this is I do it for you or we do it on ourselves, it doesn't matter. So post-hypnotic suggestion is suggestion made to a person after a deepening state while in hypnotic trance. Suggestions gets embedded into the psyche. Everybody knows about it, and that genuinely works, because at that very point of time our level of assimilation is increased, and once it is thoroughly assimilated, naturally we are very likely to act accordingly. Cognitive behavior hypnotherapy. The goal of cognitive hypnotherapy is to dehypnotize. Why this particular? The client, in order to alter thoughts and actions on a certain issues, in a way, when we are doing it, we have to discuss all those things when the patient is aware that yes, this is being discussed, but he is trying to see the situation from a distance. I mean, a sort of objective feeling they will have at that point of time. So that definitely helps us. If I am becoming neutral to certain things or certain happenings or certain experiences, my thoughts, naturally, if I am seeing it from a distance in a neutral way, my perception about that particular thing starts changing accordingly. So sometimes that this is a very facilitative method for cognitive behavioral approach also, if we combine it with the hypnotherapy, which many people are practicing in fact, and this is yielding good result, not only in terms of the improvement but the sustainment of the improvement, which is, I always think, that is more important in fact in time to come, because suppose a client comes to us and we have help, but for how long he is able to sustain on those recovery or improvement, that determines the actual outcome of that particular approach of treatment. So hence, in cognitive hypnotherapy, the patient can be taken into hypnotic trance. That is one phase. Yes, that is obviously we have to do it. And once he's into the trance, his conscious inhibition is reduced. As I have told, that at that point in time, the level of assimilation automatically starts increasing, because they will have better receptivity with minimal of barriers. So his thoughts can be thereafter altered through a clinical interview. What are methods we are comfortable with as a clinician, we should apply it, and gradually we have to take all those constructs into our therapeutic planning, so that gradually we are able to transmit the relevant information and share those things in a meaningful way with our patients. Hypnoanalysis, one of the oldest and very popular from where we started the journey, in fact, and that is how this became popular years, centuries back. Nowadays, there are very few people who practice it in that particular way, but still modified ways are there where we can definitely apply our own understanding about that particular analytic approach for helping the individual. So, for example, like in hypnoanalysis, that is implied suppressed, especially for suppressed memories or old intrapsychic conflicts which we are not aware about. We actually don't know many times that what all is happening or what all is troubling me. and we are not able to ascertain those aspects. So definitely these things in due course of conversation will help us. So it can be applied directly to memory recall, or more subtly through the use of other therapeutic techniques like free writing and sketching. That is very important. This is not typical of the actual psychoanalytic approach or analytical approach. Here we sit with the patient and that trance is maintained actually. I always tell, when there is a good class, we go into trance. When we are reading book, we also reach into that phase of trance. So that depends that the type of activity we are involved in, how much interested I am into it, and that determines. So if there is a good rapport and the things are moving in right direction, that at point of time, it is not necessary that we go live by the verbal discussions, but we can get or solicit their help by way of providing them the sort of situation where they will be able to write something or sketching some figure, what all you want, that can be applied. So in general, I am talking, it is not for any specific disturbance as such. The affect bridge is a hypnotic technique that is distinct from standard psychoanalysis. That is what I said. Bridge assists in client remembering the older experiences by bringing up other memories that share the same associated emotion, in contrast to psychoanalysis. That is very relevant and important. It is not that a given memory will have very specific type of emotions associated with. So sometimes we have to dilute it, in fact, that by way of reaching to different situations where the emotions seem like very similar to what all experience did we have in the past. So in that way, this further lowers the associated anxiety, and the individual starts feeling better after discussing, passing through those experiences, or sharing everything, what all had happened at that point of time in a more precise way. Arm levitation method, this is very good and very popular method again, and this can be done like some of other methods. We are sitting and we can do it, and that's it.
होमवर्क फिनिश कर, कल पढ़ाई करनी है सिर्फ, ताकि है ना सिलेबस कंप्लीट हो जाएगा. सिलेबस कंप्लीट नहीं है.
So visualization technique. In this technique, initially one guides you into a pleasant state of hypnosis. Next, attention is directed towards the objective while utilizing your voice to help the client to appropriate emotional state. And I tell you, we can do mastery only after certain period of time, because first we have to develop confidence. How do we induce? How do we proceed? What are the steps? How confident you are feeling? And then in due course of time, once those constructs are built up within you, naturally you can move ahead with this particular method. But we have to prioritize our emotions if we want to succeed. Yes, nowadays we talk about the emotional regulation. So everything can be combined gradually so as to help the individual that the sense of control re-emerges in the individual, what may be that knowingly or unknowingly that individual had lost because of certain conflicts, stresses in their life. So what are the actual, now we are coming to the point actually, the clinical applications of hypnosis. Why this has been something we have been thinking that we should start using these things in our profession, and that is being used. So in fact, if you go through any book, literature, there are plenty of clinical conditions where hypnosis has been found to be effective method of helping the individual. So hypnotherapy helps to manage symptoms in the following psychological conditions. These are very few, but when I'm telling about the psychological conditions, there are few conditions which are common associated with most of other disturbances. For example, anxiety, associated distressing experiences, depression, right? So those components are to be identified in the very beginning, so that first we must learn to alleviate the level of anxiety, so that what all further processes is we continue with where receptivity starts improving in the client. So anxiety, panic disorders, phobia is one major area. So many people in our country, besides in other places, they have tried to apply this particular method mostly as an adjunct with good result. I will come to that. Post-traumatic stress disorder, neurosis, psychogenic pain, dissociative disorder, asthma, gastrointestinal disorders, plenty of things, dermatology, oncology, eating disorders, habit and impulse disorder, psychosexual problems, sleep. In substance abuse, we also use it. And very primary thing is, for example, say smoking also, and infertility. The technique, however, should not be applied in patients having some major problems associated with that, especially the physiological one. So, how hypnotherapy is used to treat anxiety? Anxiety is the nucleus of many problems, that is certain. So, if we are able to identify that, probably that is the thing where we have to target to start with, and especially when we are dealing with the anxiety related disorder. So, naturally, that has to be something from where we have to be very clear about and move ahead. Anxiety is caused by emotional memories that provoke the fear response, that is true. Amygdala's emotional memory is embedded into the circuits, that is all right. Explanations, that is okay. Visualizing oneself as being in a safe space is nothing like that. Everybody wants security, everybody wants a safe environment to live, so that they are able to inculcate the qualities which further protect them. So while remembering the fear-provoking stimuli, that is important, which inhibits amygdala and extinguishes the fear of conditioning, following the principles of paradoxical intention. So this is only one, because everything is interrelated. It is a very vicious circle. It is not which came first. And we are trying to combine everything in a way that, yes, it is not the anxiety which came first. There are situations which will automatically attract anxiety, right? So management of anxiety is important, in fact. So that is what is there. Once in trance state, the person can be helped with anxiety through following procedures. Imagining pleasurable situations. So that is very important, because whatever method we use, situation or phase comes, when pleasurable situations immediately bring down the level of anxiety, right? So that is something that gives ease and a sort of sense of control in the client. That is very significant point. The moment I start feeling that the things are under my control, or I can control many few things, naturally I will start looking forward to go ahead. Altering negative self-talk pattern during decreased inhibition. That is important, because negativity is something which is very much part of us, especially when we are in crisis, or when we have not been able to overcome some of issues in our life on long-term basis as well. Mindfulness is something which is being practiced, and if when we combine it with say mindfulness is done to help the people with anxiety. Ego strengthening is something which is very basic ingredient of any psychotherapy, just to ensure that the individual is able to have better sense of control. So it is also used to treat depression. So techniques used in hypnotherapy to treat depression include ego strengthening. As I said, this is common. Anxiety and depression, there will be many similarities, I tell you, and both of them generally will exist in many cases simultaneously. Of course, the intensity of one thing might be a bit more than the other one, but both of them are able to reciprocate each other that way in a negative way. So, inducing a sense of safety and security. Yes, when a patient comes to you, when a client is sitting in front of you, if he feels that yes, he has come to a right place, he has come to a right consultant, he has come to a person who knows about the subject, who can empathize with me, and probably he or she is the right person who will eventually will be able to help me to come out of the crisis I have been living with. So all those things. So that is a sort of a very psychological feeling that automatically starts inducing, say, a sort of feeling in the individual the moment you happen to meet your client, and that is sometimes that is inducing a sense. So sometimes by way of your own expertise, you have to induce it in due course of time. We need not to discuss each and everything in our first session or immediately. Let the things sink in due course of time, assimilate it, and maybe that they will have certain apprehensions that is to be clarified, and only thereafter they think that probably they are in the right place, or the things will be under my control in due course of time, even when they leave you and go back home or the place they are living in. So, altering thinking style from ruminating to experiential approach, that is important, because mostly what is happening, so that when we are going for hypnosis, you will realize that this particular part, we allow them to share what all experiences do they have, how do they live, how do they think that they are undergoing depression, what is their view about that. Let them speak, let them come out. And when we are doing it sometime, as in the beginning, we are talking about the, say, post hypnotic suggestion, so that is definitely given, and that genuinely helps, I tell you. Experiential thinking involves realistic thinking with reference to the present context of the problem. That is linked. In the beginning, the patients are not able to relate with the actual outcome, but in due course of time, they start learning, and their very perception about the problem starts changing also. Targeting trauma, memory, or anything to do with the trauma, uh, building resilience by accessing positive autobiographical memories. This is very innate quality in each one of us. We should never forget. The only thing is that we have to be reminded about it consciously and subconsciously, and there hypnosis works. That yes, that is something we cannot live without it. If I will fall, so I have to get up. If I have a feeling of, say, negativity, in due course of time, I will definitely come out of it. The only thing is that how early do I come out of it? That matters, and that is facilitated by our hypnotic trance, where all those things are facilitated by way of helping the individual to realize that nothing is impossible in the world, and the things are very much under their control. Inducing positive emotions through suggestions, yes, as I said, that it is the suggestions which matters, like we do in other therapies. So when we are doing with the help of hypnosis, why not? And that else better result, and we have done it on many cases, I tell you. Hypnotherapy is used in phobia. Yes, any anxiety provoking disturbance can be easily dealt with hypnotic approach, hypnosis. We can go for hypnotic suggestions, we can go for relaxation, we can help the individual to see the world from a different perspective or from a distance. So, everything lowers the associated anxiety with anything to which we think that that was a phobia. So that is something. And when the sense of control update now, but these are the very basic methods actually what I have mentioned here in the, say, our PowerPoint. So most of our learner friends understand what it is. Desensitization, these are the not new method, but yes, if that is added in that phase, discussed in a little relaxed way, so automatically the things will showing improvement. Now, neurosis, different population I have just touched actually, so that our area of interest, if I have got area of interest, say neurosis for children, why not? And that is wonderful, I tell you. There have been at least 2 dissertations which were carried out in our institute on this particular topic. Excellent result, I tell you. Unbelievable sometime, I think, that even after 1 or 2 post-hypnotic suggestions, they did not again go for, there was no bedwetting, I tell you, and that was very surprising to teachers and their family members. But if that is done properly, and that too, I must tell you here that this particular treatment was done in their own setup, I mean, school setup, right? Because they volunteered, and some of them volunteered to come up to our institute. And the principle has been very simple. We have been doing it, say, basically with the operant conditioning method initially, but post hypnotic suggestions gave such a good result that I thought that yes, I do not use it rather as an adjunct as such every time. I think that many times once you have got a good rapport with the child, you can directly go with the post hypnotic suggestion, and immediately that will give you the result. And if that is repeated after a week or 2, you will see that maybe the majority of cases, I tell you, we had taken in 2 different years, 12 students each, and there was no relapse even after 6 months, I tell you. It's unbelievable, but that is what happened. and sessions were hardly 3 or 4, maximum for one child. So this is the type of response we get, and this is not for any specific gender. I am telling both the genders were taken depending on the problems they had, and that were carried out by our students, and maybe that were published also, at least one paper I remember. Underlying conflicts leading to bed waiting, these things we discuss. That is very true. We have to discuss everything in the first session, but gradually we have to help the individual. Okay, now we have discussed bladder control, every issue we discuss, but in due course of time, gradually we will take him into interview to her into interview phase, and then finally we'll go for this thing. So that is how the things happen, and that gives wonderful results. Using hypnosis to treat somatization. This is the major problem we come across in a medical setup, and lots of referral we get. And somatization is directly linked again to the anxiety, I tell you. So what all somatization problem individuals come, it means that you have to identify the anxiety associated with the problem. So whether this is there are different type of issues, different type of disorders you will see, and there you can identify the problems and deal one after one, that what is disturbing more. You prepare a list, and when you start discussing, automatically you realize that the client is participating. Client is trying to discuss more and more things. And that is the phase when you have to realize that you have got very good rapport in form of trance. Because when the things start happening automatically with minimal effort, it means the rate of assimilation in the client is maximum. And if the assimilation is proper, I tell you, we are very likely to have wonderful result in terms of the response they will start giving to us. So decisional conflict, we can use any term, I tell you, but ultimately it is the clinician who has to decide what all they want to start with, what all priorities do they have, and that will be prepared in consultation with the client, of course. But this is your own clinical judgment. From where you have to start, what you have to start, when you have to do specific suggestions, specific discussions on that topic, what home work assignment we are interested in, everything is to be discussed, and that definitely helps the individual to have a better sense of control in somatization. For example, pain. So what happens in this? Simple relaxation. Whenever a patient comes to us, what we will do? First, we will try to help the individual to learn how to relax. And when we go for hypnosis, then globe anesthesia, that is gloves anesthesia, right? That is all right. That is a sort of test. That is only to convince yourself, I tell you, and to help the individual to realize that how our sensations can be felt in a different way, right? So there is nothing in reality, but you are feeling so. So that is our perception also and understanding. So that is why this particular method, technique, numbness, this before applying the technique of numbness with the sore spot, the patient is instructed to anesthetize or numb their hand. So that again psychologically makes them feel okay, this may be created, this can be done. And that starts helping the patient or healing the patient at that very point of time. There is not a single correct script for this, I tell you. So it is advised that the therapist adjusts and changes it to suit their preferences. Please remember, I always repeat it for all the disturbances. This is your own skill. This is your own level of confidence and comfort and your own conviction that what is required, when it is required, how much it is required. You start moving it. I tell you, you are going to get good results. And for each and every case, this has to be individually tailored thing. There are few things which might be common, but every individual is different, and accordingly we have to also modify our approach to reach to the requirement of our patient. Pain dialysis, these are the methods: distraction, dissociation, corrective imagery, phantom. These are only ways of helping the individual so that they are able to get rid of their pain. So it is not that that is something which will happen instantly. Yes, there must be the very first sensation of being relieved. that should be the feeling, or that should be the reporting of the patient if you are sitting with or you are dealing with. So what kind of dial is you, that is different. That is, I tell you, that is not very important, because we cannot have a very structured format in terms of this. But yes, we can always have the structured way of helping the individual. What is something which is likely to help the individual to feel or to experience lower intensity of pain, right? And that is why some of the methods you are seeing on the screen also. So this can be practiced, and this is in general. Please take it that way. This is not for any specific patient as such. I will just skip because this is something. Okay. PTSD. It is believed that those with the PTSD are more hypnotizable. I am not going to get into it. I think that if you are convinced that yes, you are doing justice to your client, everybody is hypnotizable. So it is nothing like somebody are vulnerable and somebody are not. Maybe there will be some element of resistance, not because of anything, but because of the approach we have to reach that individual psyche. That's very important. So, okay, that is reported, that is all right, but purpose is very clear that one could argue that the recurrent experience of negative trance are a feature of PTSD sufferers' illness. Patient can take charge and experience, yes. That is what, when you retake them into that particular phase in a neutral manner, seeing something from a distance, being away from that, and that is, I tell you, that is the excellent way of continuing with the client. Very gradually, they will start sharing their experiences, and sometime you have to take the lead. I tell you, no problem. I once you have got the overall understanding, but what all experiences this individual had, sometime you have to take it forward. So there will be good speed also of recovery, as well as the comfort level of patient is also not touched that way directly. This promotes an increase of hyperarousal. Reminiscences as constructive, yes. And by using imagery, patient can modify both explicit, implicit. Everybody knows about it. So what is happening when we are reliving that particular experience in reality or in vivo, everything is so in virtual level when we do it, even online. So this thing happens that way. So otherwise, when you are giving the instructions, they are trying to relive, imagining those things, and in the beginning there will be some element of agitation in some of the cases. But once you are there besides them, they realize that there is somebody to fall back upon at the time of crisis. I tell you, they will keep moving ahead. So that is the basic point to be conveyed to the client, that he or she is not alone in the journey of recovery. You are always there with them, and that, I tell you, that particular feeling, support, definitely help the individual to look forward, or they think of taking the risk, they think of going ahead, even if they are having some issue, they will discuss it subsequently in the last phase of that particular session. So, treating eating disorder, these are very common disturbances we come across nowadays, especially, I tell you, and say include targeting shame and guilt, body image disturbances, low self-esteem, cognitive distortions, and all that. Okay, that is all. The techniques include ego strengthening. That is the basic, as we have been talking, that this is the primary requirement. If I have got good ego strength, so naturally I will be able to cope up with many issues in my life. So coping mechanism will be better. So naturally, these people will have some thing weak, and that is basically the weak ego strength. So that is to be strengthened by way of helping those individuals to realize that, okay, what all has happened in your life, that was something in your control, and again you will be able to do it, because most of the things we think that they are environmentally driven, but this is the type of response we give by way of in what way we have seen that particular object, or what was our perception, and that determines our response. So that is okay. Self hypnosis for eating, we sometimes we provide the training that ultimately it is the self-hypnosis. Every day we do it actually. But suppose there is some work which is pending, I have to do it. So we keep giving assertive statement to ourselves, right? That yes, I will be able to do it. I know I will be able to do it. And self-hypnosis is something that is purposely told to be done by them, that no, I will be able to control better. No, I am not going to avoid this thing. This is something but everybody take. So this is basically that becomes the internal system which helps the individual to respond to given situation. Developing alternative coping strategy, as I said, hypnoanalysis, turning anger and everything, these are associated, not primary one. So primarily we have to help the individual to realize that nothing is out of control. Everything is under your control. This is your own perception which is determining your action, right? So once those things start coming into the mind, and hypnotic suggestions are during trance, these are the best thing to be told to the client, because those things remain there, the psyche, for a very long time, long period. Smoking cessation, yes. Substance abuse, we should not exclude that also works. Ultimately, each and every individual is a thinker. Each and every individual knows in heart of his or her heart that what is right and what is wrong. What I am doing, maybe that others don't know, but at least I am the witness of myself that what good or bad things I am into. So smoking cessation, again, it's something where this can be done through suggestions as well as through art of suggestions, both ways. So this can be practiced. Many people have done, and I tell you, this also yields good results. And we have done it with some of our patients with very satisfactory result, I tell you. Yes. Psychosexual problems, again, it is the psyche which mostly psychosexual means is that it is basically the psychology, the individual, or the psychic conflicts, or the way we look at the sex that determines our behavior. And many things we learn from the literature, many things we learn from friends, other persons, many things which are genuine, and there are many things which are not something to do with the reality. So psychosexual problems, lots of psychological elements are associated with psychological problems. So self-hypnosis is a common treatment that comes little later. This is written on the top. Concerns about the in what way do we look at it? What all guilt do we have? What all negative body image we have developed? Why am feeling afraid of having sex, or being afraid of having sex can be helped by hypnosis. That is very important to be told, because it is not the afraid of having the sex, it is the lack of initiation, lack of confidence that becomes the deterrent. So again, it is the anxiety which is a major deterrent. So once we have helped the individual to control the anxiety or to manage the anxiety, automatically many things will start improving. And in due course of time, when the individual feels that okay, this thing I've been able to control, naturally I will have better sense of understanding in terms of realizing that the things are under my control. So that enhances efficacy of various psychotherapeutic techniques. Many people have done it in conjunction with many other therapy. That is what is advised. And please remember, I am not the one who will always be going for advocacy of only one therapy at a time. I always tell that we have to go for holistic approach. What all best techniques are available, and if we are able to combine at the right time, then that is likely to give the optimal result for any disturbances. And hypnosis is something which can be easily fitted, I tell you, in most of the therapies. Who does not want to develop that sense of control? Who does not want to realize, okay, this is my perception which is troubling me. I can control my anxiety, right? I can relax myself. I can be focused, right? The moment I am focused, I will be able to see the world or any stress or any good or bad thing in a very different way. And accordingly, I will start responding. So sexual problem, the sex, anything to do with the sex, it associated with anxiety. Anxiety, it is the anxiety management. In fact, I tell you, that will automatically improve the sexual problem of the individual. So that is why this is important and relevant for us also to understand and many people are practicing it, but different disturbances. Uh, I remember a few articles in our Indian Journal of Clinical Psychology, Indian Journal of Psychiatry, using, say, hypnotherapy in psychosexual problems also. Sleep disorder, yes. This is one of the biggest challenge to each one of us, because nowadays people come that they are having this thing. So one thing is simple, that we talk about the sleep hygiene, and then gradually for sleep disturbance, if somebody is coming, so it is the relaxation, self hypnosis, right? And this must be done along with sleep hygiene instructions, because that is important. It is not the, you say anything that something will happen all of a sudden. So we must learn to relax. We have to go to the bed only when we feel we are sleepy, right? So there are many other sleep hygiene points that is to be incorporated. You're identifying underlying conflict during hypnotic trance and addressing them in a regular psychotherapy system. When we go for it, we try to find out what all problems are distracting, what all problems become uh, something so anxiety provoking that you are not able to slip into the sleep, or what is something which is disturbing continuously. Why cannot we postpone it? Why can't we try to find out to resolve those issues, right? Who does not have a problem? Who does not have issues in life? So when you start generalizing it, then the individual feels that I am not alone in the journey of, say, this particular type of problem, or I am not the only one who is facing this type of situation. And then they will start feeling that, okay, if others can control, others can have, say, better understanding that how to get into good sleep, they will learn. So hypnotic trance, here also we give the suggestion, and everybody goes into trance before sleeping actually. So it is not that we are doing it initially, we will do it uh, from our side, and in due course of time they have to be trained that they do it automatically, self hypnosis. And so it is not exactly the hypnosis, but that will definitely help them to take them into the trance, and gradually they will slip into the sleep if they have started giving auto suggestion. That is what is important. So these are some of the references I have given. I have been uh, very fast, in fact. So I hope that I have been clear about what I wanted to talk about. And my very purpose was that all my friends who have joined today's program, they must be sensitized and realize that if we are using this particular technique, this can be applied in wide range of clinical population. We should not be hesitant, and there are professionals, we can always seek help from each other. So once we start sharing our experiences with each other, like this platform, naturally that instills lots of confidence in the clinician, and it is a matter of skill and practice, I tell you. And if you are genuinely interested in this area, I think this is a wonderful area. And I have been practicing it for years. And what I have learned, few things I have definitely tried to add here. And I believe that there will be some discussions also. And there are many more experienced people also I am seeing who have established this school of thought in a more structured manner in our country. So maybe that their comments will be further adding knowledge in our understanding about the hypnosis. So thank you very much to each and everyone for patient hearing, and if there is any query, I am open for responding to it, sir. Thank you very much. Once again, thank you very much. Yes. Yes.
Thank you very much, Professor Amool Ranjan. It has been a very wonderful experience watching this presentation. The whole of the hypnotherapy course was as if you have presented in a very compact way. And now I would like to invite President of Academy of Hypnosis, Dr. Palansa, to kindly give a president's address, which we missed in the initial part. Dr. Palansa.
Thank you, Nidhi. The outset, Dr. Amool Ranjan, the presentation was really very, very useful to our many of the students who have joined and thank you very much for accepting our invitation. So I welcome all of you here on this occasion of second Foundation Day of Academy of Hypnosis. In these 2 years, we have done satisfactory work. We hosted one international conference, and we are planning for the second conference in Pondicherry during January 25. We are meeting every month for our clinical meetings regularly, and many cases are being presented. So I wish that we continue and we expand our activity also. I invite people from the audience who have not registered or who have not taken membership in AoH to please take membership in Academy. We are in the process of getting a constituent society with International Society of Hypnosis, and very soon we will be one of the constituent societies. So I invite people to join. And yeah, today we have another speaker, Dr. Dayal is there. So maybe invite Dr. Dayal. Thank you very much.
Yes, sir.
I
Yes, sir.
welcome all of you once again. Please.
Thank you, sir. Before moving on to our next speaker, I would also like to invite Vice President of Academy of Hypnosis, Professor Rakesh Jain, sir, to kindly share with the audience about Academy of Hypnosis, the upcoming conference, and other things. Thank you, sir.
Thank you, Nidhi. थोड़ा इसको स्क्रीन शेयर इनेबल कर दीजिए. Thank you, sir. Respected Palan sir, all members and office bearers of Academy, all the audience, guest speakers. I'm presenting a brief about Academy of Hypnosis.
Yeah. So,
Co-host बना दीजिए.
yeah, co-host बनाना है, Dr. Palan. I would, yeah. Dr. Palan sir, एक बारी हम Dr. Jain को भी co-host बना देते हैं.
Can we put it in a
Yes, sir.
second gallery? Okay. Yeah, I'll make you co-host now.
Yes, sir.
Okay, you will be able to share, sir.
Okay, thank you, sir. So, Academy of Hypnosis India, it was established in 2022 as an association of professionals who specialize in hypnosis for health, harmony, and happiness. The mission of Academy of Hypnosis is to promote, advance, and safeguard the interest of hypnosis as a profession and a specific discipline of science engaged in teaching, research, and applications for human welfare. We have conducted several activities and achieved milestones during the past 2 years. We hosted first international conference of Academy of Hypnosis in Baroda on 26 February 23 in collaboration with Charotar University of Science and Technology, supported by the MS University Baroda, Gurukul Kangdi Deemed University Haridwar, Institute of Psychiatry Kolkata, Indian Academy of Health Psychology and Clinical Psychology Society of India. It was a great success. And during this conference, first conference, we conducted pre-conference workshops and post-conference workshops on topics of psychosomatic problems for successful dentistry, clinical hypnotherapy, an introductory workshop on beginners, past life regression therapy, hypnosis for sleep disorders, pediatric hypnosis, and cognitive drill therapy. The response in all the workshops was overwhelming. Then we had international speakers during the first conference, Dr. Stephen Langton, who is the editor-in-chief, American Journal of Clinical Hypnosis, Arizona, US, Dr. Nitin Sukla, who is a consultant psychiatrist and psychotherapist in Australia, Dr. Mehdi Fati, President, Asian Society of Hypnosis from Iran, there is some problem, I think.
No, I think now we are audible, sir. Please.
It's visible also, sir.
Visible, sir. Okay, thank you. 1 minute. So I'm having problem at my end.
We are able to see your slide.
Sir, some problem is there with me here. Now, sir, it is visible?
Yeah,
Dr.
visible.
Bernhard Trenkel, Director, Milton Erickson Institute, Germany. All the speakers delivered excellently, and the presentations were very informative. Now we are moving towards second international conference of Academy of Hypnosis, scheduled to be held on 24th and 25th January 25 in collaboration with Indian School Psychology Association. The venue of the conference is Pondicherry University, and on 23rd of January we shall be having pre-conference workshops also. We are very soon will be having our detailed announcement of the conference. And in these 2 years, we have published 2 issues of newsletter. First newsletter was published, volume 1 in June 23, and the second one was in January 24. And third is being prepared, and it will be released very soon. And we are having regularly monthly clinical meets in which the professionals present their cases in which hypnosis was used to treat the various conditions, clinical and non-clinical conditions. And these clinical meets are really very useful and informative. And Dr. B.M. Palan, Ginny Gopinath, Dr. Baljit Kaur, and Nivedita presented a symposium on hypnosis in illness and wellness during the 8th International Conference of Indian Academy of Health Psychology held at Goa from 30th November to 2nd December 23. The first foundation day was celebrated on 24th and 25th June 23, and 2-day events were organized. The first day, an informative session on basics of hypnosis for beginners was conducted, and on second day, advanced workshops were conducted for practicing hypnotherapists and clinicians. The AoH has developed two-level programs for professionals, medical professionals, psychology professionals, and other professionals who are interested in hypnosis and joining Academy of Hypnosis. These programs are being launched. This is the website of Academy of Hypnosis, where all details are provided. The inspiration behind all this Academy of Hypnosis and the entire programs we are conducting is Professor Dr. Bhupendra Palan sir, who is rightly said, Nidhi, that he is the backbone of all the programs. Thank you. Thank you very much. Thank you, sir.
Thank you, sir, for sharing the achievements of Academy of Hypnosis with all the participants. I would now request Dr. Prasanta Jain to kindly introduce our next speaker, and then we shall begin with the second presentation of the day.
Yeah, thank you. We are happy to have Dr. Dayal Mirchandani, a veteran psychiatrist of our country, a fellow of Indian Psychiatric Society, and who is quite enthusiastic about hypnotherapy. Not only enthusiast, he had been teaching hypnotherapy for long there in Mumbai and now in Pune. Also, the way he guides us with various papers, various books, and various understanding that has been quite enriching. And whenever we are having such a senior professionals with us and to guide us, and that is always a pleasure. And we would like to listen to him for today. Thank you, sir, for joining us.
Uh,
Should I?
yes, sir. So shall I start with the screen share of your presentation?
Yeah, sure, please.
Yeah.
First, let me thank Dr. Palan, Dr. Rakesh Jain, Dr. Prasanta Roy, Nidhi for inviting me. I'll keep this short because I know it's getting a little late. So let's start. The reason I've chosen this topic is
Maybe you may start screen that slideshow.
Yes, sir. Yes, sir. I'm doing that.
Sorry. Yeah.
you can move to the next. Yeah. Okay, so the reason I've chosen this is because most doctors don't have the time, or even clinicians. They, they just want 15, 20 minutes, half an hour, or they see a person for one or two sessions, but they don't want it to go on for months and years. So I'm looking at it's not for every patient. It's for people with mild or moderate issues, mainly medical, but also it's been used with other psychological and psychiatric disorders. It can be used with high and low hypnotizable patients. In fact, it works, with a low hypnotizable patient, suggestive therapy might not work as well, while in fact it works better with them because with high hypnotizable, often patients' problems are caused by suggestion. And high suggestible patients are more likely to relapse. So contraindications are psychosis and severe issues. That means people who are cutting themselves, self-harming, suicidal, very poor sense of what's right and wrong, those kind of things. People who have severe asthma, for example, status asthmaticus or status epilepticus, these are severe, which they often would need hospitalized. These patients should not be treated. Let's move to the next slide. So there are some of the indications: psychophysiological, asthma, irritable bowel syndrome, headaches, anxieties, phobias, habit disorders, I think mild depressive disorders, sexual disorders. Many of them have been already described by Dr. Amool Ranjan, but I'll just go over it quickly. And dental issues, patients who have needle phobias, have phobias of going to the dentist, bruxism, which is grinding of teeth, and pain in this area, the temporomandibular joint, because either they grind their teeth or they keep this clenched tightly, and that leads to headaches and neck pains and other things. And these things can be very rapidly resolved using. So often, when you're doing medical and other these kind of issues, the patient is in pain because they've got a dental abscess or something. So they need something really fast to help control the pain, so that they can. If they have a needle phobia, they're not going to agree very easily to anesthesia. Things like that. People who are gagging, the moment the dentist puts their mirror in or a hand in, they start, throwing up, that kind of thing. Can you move to the next slide, please? Okay, so let me tell you why I've chosen this approach. Dabney Evin was a surgeon, and the first I heard about him was there was a video also on YouTube. I don't know if it's still there or not. He was working for an aluminium company, and one of the patients got burnt. And when they make aluminium, they use aluminum oxide, which is the ore, and they heat it to a huge temperature, and then they, and then this patient got some of it spilled on this patient, and he used hypnosis, and he had pictures and videos and all those kind of things. And what happened is that patient recovered with hardly any scars. And in fact, he presented it at a case at a conference, and he overheard two surgeons discussing, I was nearly convinced by what he's saying, but this hypnosis is all bunk, So he got even more active in promoting hypnosis after that, and got involved in hypnotherapy. And himself, he had received as a youngster, as a boy, before he became a doctor, he had sinusitis every year at a certain time of the year, and they had to puncture and do other things to his sinus. And a lay hypnotist hypnotized him, and in one session healed him of that. So he said he realized it was very powerful. He learned from Dr. Cheek and from Licron, and the method is fairly easy to learn. So hypnosis believed in imagination. That means the patient can even be, not necessarily in a very deep trance, but if they believe in what is happening, it's a mental activity rather than a relaxation, which can. So you can be walking or talking while hypnosis is happening. There's waking hypnosis. So relaxation is not necessary for hypnosis. So we have two hemispheres of the brain, the left and the right. So this is not really absolutely accurate, because both do, they both do many of the things jointly, but the left brain is the conscious part of the mind, the will. That means, we tell ourselves this, we'll do this, we do that. It's verbal, it's logical, it's temporal. That means time it takes care of, literal, analytical, and it's optimistic. And the right brain is non-verbal. It's creative, it's intuitive, it's artistic, it's reflexive, it's more into the body and feeling, and sexual, and it holds conflicts and traumas and other things in the right brain. And it's also pessimistic, unlike the, okay, move on, please. Okay, so now, which is the dominant of the two hemispheres? Is it the left? We know that we say the right-handed people are, right-handed people, the left side of the brain is dominant. 85% are right-handed, maybe. But actually, it's the right hemisphere which really controls. That's our imagination. So if we will that we're going to stop something, we decide on New Year's Day that I'm going to stop eating, I'm going to go on a diet. And then afterwards we find that, we see some chocolates or cake or something, and we eat that. So it's the dominant effect is of the imagination. It dominates our behavior, our activities. Please move on. Okay. Now, when you're dealing with the patient, there are two things you have to realize. The first thing is self-preservation is important. When you're thinking about the genesis of a problem, is, why, what is happening? So the patient doesn't want to die. He wants to protect himself. He doesn't want to get hurt. That's why the first thing is self-preservation. The second thing is preservation of the species. That's parasympathetic part of the brain, which is reproduction, sex, and care for the family and the tribe. So that's the second part of it. But all these things have an importance when you think about a problem, you've got to think from the patient's point of view, not from your point of view. So please move on. I'm going fast, and I'll slow down a little while. So, okay. So the way Dr. Cheek, Dr. Licron, Dr. Cheek and then Dabney would access the right brain was through ideomotor signaling. Now, if I ask a patient something, what is the cause of your problem? There'll be many red herrings. They'll tell you, my mother was beat me, or someone bullied me, or whatever. But really, we wanted to come from within the person's right side of the brain, or from the inner mind or the feeling mind, and not from the conscious left-sided brain. So one way is through ideomotor signal. So that means you use finger signals, like just for a yes, another signal for a no, a third for a I don't want to say yet, or something of that sort. So you have to first teach the patient. So you're not making them do it, because people don't react well to being forced to do something. So it's a teaching attitude. The second part is that you can do it even in a waking state, many people. So if I ask someone a question, is this, do you like this person? He might say yes, verbally, but his head is going like that, saying, actually, I don't like him, but I can't say that. And then you ask the person to let his mind enter the daydreaming mode. That's just for teaching, that people don't want to go into a trance, they're afraid of getting stuck there, other things. You're talking about just getting them into a daydreaming mode. And one sign of trance that is that patients in a trance do not talk spontaneously. So unless you ask, they won't normally talk. They won't keep chatting and talking. So you kind of keep taking them deeper till you get to that point. And then you tell them that you'll teach them how to, with your feeling or inner mind. And you need to, if you keep your hand straight, it's very difficult to lift this finger because of the way the muscles are constructed. So you need to keep it either like this on a arm of chair. This is very easy. Or if the person is sitting on their lap, or if they're lying down on their belly, so that the hand is flexed a bit, so that it becomes easy to for them to move. And then if it's if you're face to face, then you kind of touch that finger, tell them that I'm going to ask you a question. Is your name, your name is so and so. If that's right, let this finger say yes, or something of that sort. Or today is such and such date, until you get a yes signal. And a sign of an unconscious signal is that it's vibratory. It kind of moves up slowly, and it has a kind of, well, conscious signal will be just, it goes up like this. And you also give a suggestion that each time your finger rises, you go deeper into a trance. So even if the patient is not in a trance, once they start moving their fingers, even if they're doing it consciously, they start going into a trance. But the idea is to get them into a trance. So, and if they're in a trance, they keep going deeper. Okay. Next. See, you can use it without a trance, just like people, had movements, but most often we'll use a trance because it's much easier then. And this can be used for diagnostic purposes, diagnostic in terms of to the cause, and also whether it's like psychological or physical kind of problem. Is there some inner reason, or is there a feeling reason? It can also be used to interpret dreams. So again, by asking, if there's a certain figure, is it a friend? Is it your brother? Is it your sister? Is it your mother? Is it someone you know? Is it someone, but and the fingers will answer. So you get a no, you'll get a no, and then suddenly you get a yes. So it can be used for dreams. And the more important thing, that it can be used to access pre-verbal memories. We remember things after the age of 2 and 3, most people. Before you start working on a problem, you get permission from the inner mind. You ask, is it okay for us to work on this problem? Now, when someone went to Dr. Dabney, he had his own way of questioning. So he would start with asking, what is your problem? Rather than, we mostly would say, what brings you to see us, or how can I help you? But his thing was, let's focus on the problem. And the next question was, when did it start? And then he'd ask what happened at that time. And then he'd ask a few other questions. The last question was, is there anything else you forgot to tell me, or something? So, and that often, many of these things gave him an idea of where the problem arose. Please move on. Okay, so once you have an ideomotor signal, then you use that to find out what is causing the issue. So he used the acronym COMPIS, COMPISS, to remember them. Please, you can see the first one is conflict, the other is organ language, the third is motivation, the fourth is past experience, the fifth is identification. So I'll explain each one. The sixth is self-punishment, and the seventh is suggestion. Okay, so let's start with conflict. Please move to the next slide, Nidhi. So the conflict explain, is when there's something you want to do and there's something another part doesn't want to do that. You're in a relationship. You want to leave your wife and go with your lover, or you want to stay in that relationship. So for example, he had one patient, Dr. Dabney, who had warts on the plantar, that means on the soles of his feet. And under hypnosis, asking him if there's a conflict, his fingers answered that yes, there is a conflict. And so Dr. Cheek asked him, like when you don't tell them what to do. You ask, what are the two? So can you resolve the conflict yourself? Because you're pulling. So the problem is indecision, that you can't decide one or the other. So in this case, he decided whatever it was. And when he came back a week later, all those plantar warts had gone. And normally the treatment for plantar warts or these kind of things, burning them with a cautery, that means, or some acid is put to kind of dissolve them, and it's quite painful and takes time to heal after that procedure. So he had resolved the problem. The problem was that he had two girlfriends and he couldn't decide which one, or something of that sort. He had decided on which one and leave the other one, and there are many such, So the next one is organ language. Please move the slide. Okay, sorry, just go back. So when there's a conflict, you just have to get the client to make a decision. So even if the decision is not taken at the time of the session, you ask them, or you give them suggestions, that you go back and at night you dream of a solution, or which is the decision, or go and think about it and make a decision. So the problem is defined as indecision, whatever the conflict may be. Move to the next, please. Okay, organ language. So we all have and respond to organ language. Someone is a pain in the neck, your boss or your wife or mother-in-law, whoever you think, and that causes a symptom, headaches, backaches, whatever. And so you explain what organ. I'll give you a few examples. Like someone has a heartbreak, that can cause chest pain, or someone who's finds it difficult to, stand up and all those things because he's not able to stand up for himself. So that these are organ language. So you ask, after explaining what organ language is to the patient, you ask, do you sense you are being affected by organ language? And then the solution to that is to ask the patient, can you find a better way of dealing with this issue without needing to use organ language to deal with that? So this is a way of resolving that. Okay, let's go to number 3. Motivation is also secondary gain. So someone who's had an accident, secondary gain might be getting money from the insurance company, or sometimes, for example, one of the cases Dr. Dabney described was a young boy who fell down at a ship rig from one level to another, and he developed paralysis, and they did x-rays and whatever else they had at that time, and found that there was nothing physically wrong. All his reflexes, everything was okay. But the secondary gain is he didn't want to go back to the rig, but he couldn't stay that, and therefore he chose a symptom to deal with that. So the solution in that case was to find a better way. So in this case, Dabney was the company doctor, so he asked, the HR to arrange that he gets a job on shore and that he doesn't need to go back. But the symptom didn't go away in one day. He gave him hypnotic suggestions and other things. Within 3 days, he was walking. And within a week, he was able to go back to, he go back to work as a truck driver because that was found as the solution to him. Not, that was the solution they found. Number 4. Okay, so this is past experiences. He spends a lot of time, and I'll talk a lot about that, much more than the others. So you have to regress the question back. So first you ask is, do you feel, is there something in the past that is affecting you or causing the symptoms? And if the finger rises, then you explore. So you got to find when it was. So if you ask the patient to go all the way back and explore all their experiences and go back to anything that might be, so not once, but number of times. And then you sequentially check. So there are 2 ways of checking. One is you go back to birth and ask, is it anything to do before birth? Then you go back to the first year of life, second year of life, third year of life, so on. Or you can go, is it before the age of 20? Is it before the age of 30, of 15? Is it before the age of 10? Is it before the age of, and you go back. So each time the person is going back, he's also reviewing the experience. So it becomes more accessible. And the way Dr. Cheek teaches people to go back is to ask them to regress back to yesterday at night, just before they were going to sleep. And when they are there, let the yes finger rise. And then each time they have a dream, because all of us dream 4, 5 times, 6 times at night, let the no finger rise. Or each time they come across an emotional experience, let the no finger rise. Then they ask, is your unconscious mind ready to let your conscious mind let you know about this consciously? And then you get an idea what the issue is. So if it's at birth, for example, and there are people who have issues related to their birth. So I'll just tell you about 2 of Dr. Dabney's. One was a surgeon, 60 years old, who had terrible asthma and he's going to retire. And Dr. Dabney hypnotized him, and after the conference, they were discussing something at night in the hotel room, and he went back and he remembered this doctor's hypnosis. I mean, his asthma was triggered by cold. That means when it became very cold or he's exposed to cold, he'll get severe asthma attack. And he could remember, bright lights and coming out feeling cold and very cold, and he couldn't breathe at that time because birth for many people is difficult. So, first Dr. Dabney taught him how to breathe and reimagine being born and being able to breathe easily and freely. And then, re-experience the birth being in a warmer room and, less bright lights and all those kind of things 2-3 times. And within a few weeks, that person's, he didn't meet him again for quite some time. And that person's asthma got so much better that he could go back to work. So let's move to the next one. Identification. So sometimes some person who you love or who you care for or something has certain symptoms, stammer or limps or smokes or drinks a lot. And so one example, so how do you deal with that? You sense that you're identifying with someone. You ask that question. Or someone, do you know anyone who had a similar, who used to smoke or who used to drink a lot, who you're very close to? And you go, you kind of, once the patient tells you that he's keeping the person alive in his brain or something of that, so he's keeping that relationship alive, that's the identification, the purpose of identification. And the solution is to give suggestions. So you've got to break that idea or belief that is driving that symptom in all these cases, whether it's organ language. So that's how you kind of work on it. And often a single session or 2-3 sessions is all that is required to deal with it. So this is common with smoking, drinking, all those kind of issues. And one example he gives of this person who was smoking and couldn't give, he had failed with other smoking, what do you call it, cessation programs. And, he talked about he's smoking with his father who had died. And, when he smoked, he kind of thought of his father and he felt warm about him. And each time, he'd relapse by thinking back to that. And then, he'd think about his father, then he'd go and smoke. And Dr. Dabney was able to, reframe it and tell him that, you're not, there are other ways you can honor your father, keep thinking about him, find that, and help him kind of, and he was able to stop smoking. Okay, next one, please. So self-punishment, we feel we've done something wrong, we feel guilty, whether it's not calling up someone, not, having cheated someone, whatever the moral injury, whatever we've caused, something, there's guilt. And I've seen it many times. The first time I saw it, there was a guy who was a smuggler. When he was 17, he killed someone. He went to jail, came out of jail, but he served a whole life sentence and all that. And he'd come to my clinic and he'd want to talk about this. And then I helped him in some way. In those days, I wasn't practicing hypnosis and to relieve guilt, but I suggested something and he was able to get rid of his symptom because of that. And over the years, I've seen a number of, so it's either real or imagined. And, sometimes they won't even know why they're punishing themselves or what they are guilty of. So then you ask the unconscious mind to let the conscious mind know what that issue is. And the solution is, one solution is that have you suffered enough? Have you been punished enough to that now you don't no longer need the symptoms? Even the law recognizes that, you serve 14 years in jail, and after that, even if you murdered someone, you're let loose. Or in another case, you could say that this priest had been attracted to some woman and he was feeling guilty about that because and developed skin rashes, very itchy kind of rashes. So then, like he got him to admit that, he hadn't acted on his attraction or his feeling, whatever, but he was guilty for thinking such thoughts. And he said, you can't avoid thinking such thing, but you didn't act on it. And number two is you're punishing yourself. So that job of punishing you should be left to God because he is a priest, and not to, you're taking up the job of God, and that whatever it is, within a few days, this Tyriasis rosea, which is quite a itching kind of thing, it breaks out all over the body, disappeared. So yeah, another case is, this is a psychiatric kind of illness. So the young girl was in a, when she was a child, her father and mother were in an abusive relationship. The father would beat the mother, so the mother ran away. And she wrote a letter to the mother asking her to come back, saying that she will protect the mother. She was only 5 or 7 years or something, or 10 maybe at that time. And she, this is not Dr. Dabney's case, this is a South African case. I'll give you the reference later. And the girl came back, the beating started again. The mother died soon, after a few years, in an accident. And she had terrible headache. And this came up that she was punishing herself for calling her mother back. And in her mind, she had put two things together. Though the mother died a few years later in an accident, she was blaming herself for both her mother getting abused again, she not. So she was feeling guilty about that, and the punishment was this headache. Okay, you can move on. So you work with this by saying, get establishing innocence that, this is human, or this is, you already suffered enough, however it is, you kind of find a way of. Now, for suggestion, when people are frightened, upset, they are already in a hypnotic state, as it were. You go to an emergency room, someone had an accident, you really don't need to give them hypnotic suggestions or an induction. Very often you just tell them to close their eyes and go deeper into your feeling mind, or just drift away to your laughing place or whatever. And so in those kind of situations, you're going to a doctor, there's a diagnosis, you're worried about, have I got cancer? Have I got something serious? You're already in some kind of a trance because of the emotional charge. And whatever suggestion, for example, if it's pain, and the doctor says you'll have to learn how to live with it, can be then taken as to mean that it's never going to get better, or this is something serious, or we don't know what it is. People understand it in their own ways. So they hold books on how to talk to patients and how not to cause this kind of thing. But when a symptom is caused by this, you can identify, even if the person can't remember it, through ideomotor questioning, going back over time, getting them, like if they had an operation, or if they had an accident, or if it was a doctor, or if it was a family member in a fight, you can kind of find out what the suggestion is, and then regress the person back to when the suggestion was implanted, update this, that At that time, you're a little child, you couldn't be responsible for your mother, your father beating your mother, whatever it was, and then reframe this otherwise that, at that time there were not enough treatments and now we have newer methods. Whatever it is, you reframe and update it. And I'll give you two examples from one from Dr. Dabney and the other from the South African. So Dr. Dabney had a medical student who attended a hypnosis workshop, training or whatever, and she had a scar on her leg, and the scar was painful. She couldn't touch it, nor could anyone else touch it. And there's a recording of this in the American Society of Clinical Hypnosis, the video. And also it's described in Dr. Abney's, there's a transcript of that Dr. Dabney's book, which I've given the references at the end. So when the girl was young in the first year of life, she had what's called hip dysplasia. That means the hip was displaced from the socket where it's supposed to be, and the treatment in those days was being in a cast for many months, and which for a 2-year-old child is terrible, or 1.5-year-old. I think it was 10 months when she first, and she was, like once during that, the pin fell out. There's a pin that went into the knee. There was a hole in the cast to hold it in place or something of that sort. And the pin fell out. The mother put it back. It was very painful. So the logical thing would be to think that it's PTSD of some sort. But the thing is that there was no damage in the sense of she could run, she could play soccer, she couldn't be intimate because of the touch and all that. No one else could also touch her and that kind of thing. And so Dr. Dabney did a induction, and ideomotor signals answered yes, it's to do with the past, it's to do with that. So then regressed her back to the time when that happened, and then she asked, that she remembered that there was this time when that pin fell out. Her mother had told her about it and asked. They said no, that is not the cause. Then went back further, nothing. Then went forward to the time when the doctor took out was going to take. First she went to the back to the doctor after the pin was put back. Did an X-ray, everything was okay, so they continued the same treatment. When the time for the cast to be removed, she asked, has that got anything? Was it painful? Has that got no? Asked, did the doctor say anything that upset you? So often it's the doctor's words. No. Did your mother say anything? No. Did your father say anything? Yes. Don't touch it. Don't let anyone touch that scar. At that time it was a fresh scar. There was, like when you fall down, you have a scar. So then that they found the source of that scar. So in that one session, told she was a doctor at that time. Like she was a medical student, but becoming a doctor. So she knew that people have scars, but they heal. But the inner mind, which was the child using trance logic, when you're in hypnosis, she was in that kind of state at that young age. She took that suggestion to mean that don't let anyone, and that suggestion kept operating like a post-operative suggestion till it was, till she underwent hypnosis and it was removed by, reframing it and updating it that, once it's healed, the scar, then there's no need to be. So you can play soccer, you can run, you can have a bath, you can do everything. So there's no need to protect it anymore. And she became a surgeon. She worked in the, what do you call it? American Armed Forces. She 13 years follow-up was there, and there was no recurrence of that pain. Another case of wait one second. Another case of person who had a suggestion put was a woman in a abusive relationship. When she was having sex with her husband, the condom burst. He kind of forced himself on her, and he told her, "You're going to get, you'll get HIV now." And she got scared, and she believed it. So she developed a phobia that she had HIV, and she kept going to many doctors. And in through ideomotor questioning, they discovered that this suggestion had been implanted by the husband. And as the trance logic was that as long as I feel that I have this, I'm checking regularly, then I'm alive. So her fear was first law of nature, like I need to keep proving to myself that I'm alive and keeping alive. So again, they were able to, tell her that, so many years you survived, you had tests done, everything. And once the right brain idea was kind of updated, she no longer had that. So there are many, many examples in his book. The book I suggest is a handbook of. Please move to the next one. So the first one, Idiomotor Signals for Rapid Hypnoanalysis. It wasn't available for a long time, but now it's available on Google Books as an ebook, and you might find it elsewhere. Then there's Mind Body Therapy by David Cheek. Again, he uses idiomotor and idiodynamic, that is, sensations for therapy. So he uses a lot of his patients. He was a gynecologist, so a lot of his patients were patients with birth problems, patients with who say, he could, people who were afraid of something, he was able to give them suggestions under hypnosis to turn around the baby so it came out the right way. Many times babies come out breech, and that means the butter comes out rather than the head first. And it's more complicated in breech, it's much more difficult for the baby also. And he was able to talk to them. So after he discovered that technique, he was able to like he had no breech deliveries in the last 200 or whatever deliveries he did or something of that sort. Forgotten the number, but I had a demonstration by him where he talked about it, which I shared with Nidhi. Maybe she can share with others. Many years ago, someone had sent that to me from America in the mid 80s. So he worked, so someone who has spontaneous abortions. That means while while they were pregnant, suddenly they'd start bleeding or that's threatened abortion, and spontaneous, they keep losing babies. So he'd work on what are the unconscious factors leading to that. Maybe rejection of femininity, rejection of not wanting to have a child, feeling forced to have a child, whatever the inner mind has reasons for, or having witnessed things in childhood or sexual abuse, those kind of things. And haven't discussed many of those cases, but in many cases, it's sexual abuse or other things that are behind all these problems. And there's techniques of hypnotherapy by Leslie Licron, from who Cheek learned, and then Dabney learned from Cheek. And these two books are available on archive.org, which is a free library where you legally can borrow for 2 weeks, I think, the books, or read them online there. If anyone wants the link to archive.org, I'll give it to you. But I think getting these two books is worth it, Idiomotor Signals, because it's very easy to learn if you study the transcripts and if you read the whole book. And So I haven't gone into too much detail on that. Mind-body therapy is a little more complex because Rossi talks about theories and other things. So if you leave those out and only study the Dr. Cheek's part of the book, it's very useful. I haven't really gone into detail with techniques of hypnotherapy. I've looked through it. So these are the books. Okay, then with Dr. Dr. Dabney also recommended Antonio Madrid's work with children with asthma, infants especially, young children who develop asthma. The theory is that they are not bonded. The mother either rejects them or the mother has some illness which prevents, either they are, like they've had a cesarean, so they can't bond immediately with a child, or they have postpartum depression or something else. And that stress leads to asthma, and often that's lifelong. So either by regressing the adult back to that time and helping heal that, or if it's a child, you just treat the mother to improve bonding. And often the symptoms of, and there's a paper by Dr. Anthony Madrid. It's, if you just search Anthony Madrid bonding children with asthma, you'll find a free, it's a open access article, or if you message me, I'll send you the link. And there's a paper in the American Journal of Clinical Hypnosis in September 1921, idiomotor motor signaling with psychiatric patients. So I describe one or two patients from there. So that's also worth, because I haven't gone into really depth on how you talk to the patient, how you reframe it. All that's in the transcript. So it's fairly easy to learn. Next, please. Yeah, so just, and that's it. So we'll move next. Thank you. I just kept it short. So if anyone has questions or anything, we can do it some other time if there's no time now. And thank you for being patient and listening.
It was really wonderful. You described so many cases and very insightful presentation. Thank you very much,
Thank
Dr.
you.
Dayal. Thank you.
Yes.
Maybe.
Yes, sir. So after the after these two presentations, we come to the concluding part of today's Foundation Day ceremony, and I would request Dr. Prasanta Roy to go ahead with the vote of thanks. So please.
And thank you. And it was really a learning experience from Professor Amool Ranjan as well as Dayal Mirchandani sir. And hope the participants today would be more curious to know the use of ideomotor signal and explore those 7 and the modalities more frequently into their the practice. And thank you, sir. And we are really thankful to first of all the members of the association academy and all the participants whoever have joined for the webinar. And today is the T20 World Cup final where India is playing. And despite the final match and when our the program begin, the India also begin with the batting. And Kohli was hammering there. But still, we had over 70 the participants for the today's program, and that is a kind of a very inspiring achievement of Academy of Hypnosis. I would also like to thank uh, both the resource persons invited speakers for their consent at this late hours. Thank you, sir. And obviously, the Dr. Palan, the president of AoH, and Dr. Jain, the Vice President of AoH, and other the office bearers of the academy. And I'd also like to have a special thank to Nidhi Madam for her effort um, to continue this kind of activities, and other the members. Thank you. And I also like to thank Dr. Dave, the General Secretary of the Academy, for his frequent input and activities. And we look forward to see you all in January conference there in Pondicherry University. Dr. T. Santanam sir is there, who is the co-organizing secretary of that the conference, and we look forward for lots of learning opportunities there. And on behalf of Academy of Hypnosis, we are having the special request to Professor Amool Ranjan Singh, if you can join us there at Pondicherry conference, along with your the team of RINPAS students, and and uh, and Dr. Dayal sir. I can remember the first case when you were practicing in Mumbai. The first case that you sent to me, that time we didn't know each other, but somehow we came to know from someone that I'm practicing hypnotherapy. And you referred a case who was suffering from obsessive compulsive disorder for 25 years from Guwahati. And despite medicine and cognitive behavior therapy using exposure and response prevention, she didn't respond. And she was considered as a treatment resistant case. And when we started using hypnotherapy for this particular case, he was initially very resistant. So we had a long session using ideomotor signal only. I could convince that particular client, see the capacity of the mind. The mind can generate so many the responses against your will. So obviously, if you can guide our mind properly, the things can be quite beneficial. And then we had sessions for twice a week sessions for 2 months, and she recovered fully.
Yeah,
It
she
was
got in touch
100%.
with me a few years later to thank me for sending
Yeah,
her to you.
but she relapsed because she discontinued in between, and she
Okay.
was over enthusiastic after her achievement, so she stopped her self hypnosis practice and stopped consulting. Later on, she came again. So thank you all. Thank you. We can end the session.
Thank you, Dr. Prashanta and everyone, Dr. Palan, Professor Dayal Mirchandani, Dr. Rakesh, Dr. Nidhi, I am seeing from here. Everyone, it was a pleasure being part of today's deliberation. And thank you all the friends who have been sitting all through this deliberation and discussions of our association. Thank you very much, Dr. Prashant, once again.
Okay. So thank you very much. Thank you all.
We are ending the session.
Close.